This is a big topic that we're closely following. New York City hospitals being overwhelmed with patients suffering from RSV cases among children.
Yeah, New York is also seeing an upward trend in flu and COVID cases. Senator Chuck Schumer is calling on the federal government for help.
I'm calling on them to be ready, that if any hospital in New York says, we're short of doctors, we're short of nurses, we're short of respirators, we're short of beds, that they can come and supply those things immediately.
So several hospitals across upstate New York have already requested medical help to deal with the demand. And this morning, we're joined by Dr. Anjali Bharati, an ER doctor at Lenox Health in Greenwich Village, to let us know just how bad things are and what the situation looks like. So, doctor, thank you so much for being here.
Thanks for having me.
So a lot of parents paying close attention to this, right? What is the specific situation at Lenox Health? Are you experiencing more of these RSV, COVID, and the flu all at once? And if so, how is the hospital handling it all?
We've definitely seen more than our fair share of RSV, more than in a typical year. We're seeing RSV in adults and children. And thankfully, we haven't had many as sick that need to be hospitalized. Of course, we're a facility that transfer our patients, so we are definitely dependent on the bed situation in children's hospitals as it affects the city. Currently, we do see a good amount of COVID, flu, definitely more than the last 6 or 8 months. We feel the pinch, we feel the surge, and we have the experience that we had last year when hospitals were overwhelmed, and we really don't want it to get to that point, especially for the kids.
Absolutely. We're hearing this plea for federal help. Are New York City hospitals really that close to needing federal help? You mentioned a shortage in beds at children's hospitals. Are we also seeing a shortage in supplies as well?
Not a shortage in supplies, but like I said, we don't want it to get to that situation. We are very acutely aware of what happened with the COVID spikes, and we don't want to be in that situation again, for sure. So I think everyone's kind of feeling like this sense of like, oh, is this going to be another COVID pandemic?
Yeah.
Is this just going to be a worse season for RSV? And for us in the medical community, you know, we're aware of those transitions and those spikes, and we feel it when we work our shifts in the ER. So we don't want it to get to that point. That's why I think we're on high alert to make sure that we're prepared in the event that it really does become overwhelming.
Yeah, and for parents, you know, they're paying close attention to this, right? Because a lot more kids are getting sick, coming home from daycares and schools. Other parents with newborns being told not to put their kids in daycares. RSV cases usually peak in late December, early January. So this is early on. So do you think that COVID-19 or the flu has something to do with this happening earlier? Why are we seeing it so early in the season?
There's a few theories out there, all of which make sense. Number one is that the kids' immunity to RSV has decreased because of the mask wearing and, you know, their exposure to the pediatric viruses. Traditionally in school and daycare, that's where kids sort of build their immunity against these normally very minor viral illnesses. We think that over the last couple of years, because of the masking and schools being closed and daycares being closed and kids were at home a lot, you know, they weren't sick as much. And so this has possibly given this virus a chance to remain somewhat dormant and affect kids who have not been exposed to it before. RSV is a virus that once you get it, you know, it can be minor, it can be moderate. In some cases, it can be severe. But the second and third time you get it, usually it's less severe than the first time you get it. A lot of these kids have not been exposed at all. And so we think that their lack of exposure and their lack of immunity has made this virus rage.
Yeah, and it's so heartbreaking when you hear those kids wheezing and the coughing. For parents out there who are just trying to get their kids some help, we know there's such a demand on hospitals. What should they do? Should they maybe go to urgent care centers instead?
You know, if your child has a minor respiratory illness and they seem okay, meaning they're eating well, they're drinking well, they're not having a very difficult time breathing, you know, keeping them home is okay with the usual supportive care measures of drink a lot of fluids and suction their noses out and make sure that they wash their hands frequently and that they're hydrated. And, you know, if you really see signs of respiratory distress, meaning they're pulling, they look like they are struggling to breathe, then it's definitely time to seek a higher level of care at a hospital.
Yeah, and you know, the question here is how soon can we expect an RSV vaccine to become available? And if there is one that's in the works, you know, this is, I guess, a crystal ball moment. How early could a child get it?
Well, traditionally, we give these vaccines at around 6 months.
Right.
I think that that would be a great time for kids to get an RSV vaccine because the little ones, the littler they are, the more susceptible they are to it. I know that research has been in progress, and I think that this pandemic has really pushed the researchers to try to find an effective vaccine to prevent the severity of illness that we see in these kids. And that's always the thing with vaccines. Number one, is it effective? And number two, can it really prevent these severe cases? As we saw with COVID, it really was good at preventing the severe cases. The hospitalizations definitely dropped. And I think that they're hoping the same with RSV. If they can come out with the right vaccine, then, you know, the hospitalizations can drop.
Okay, that's the hope. Well, Dr. Anjali Bharati, thank you so much for your insights and joining us this morning. We appreciate it.
Thank you very much for having me.